Okay, we are recording, so go ahead.
Okay, so today we're going to be talking about perinatal mood and anxiety disorder case. A very depressed 36 years old African-American woman named Mandy is referred to outpatient therapy 5 months after giving birth to her third child. She states she has 2 boys and the newest is a girl. She talks with a flat affect when describing her lack of interest in being a mother. She also expresses concern over recurring thoughts of seeing herself drop her baby and cries as she discusses it, stating, "I will never hurt my baby. Why do I keep having images of dropping her on the stairs or in the bathtub, or it is so distressing. It has been difficult for her to get out of bed in the morning, and showering hygiene has been poor. She presents to the appointment wearing leggings and oversized shirt, very messy hair, and house slippers. She reports her husband is upset because he wants things to get back to normal. She also expresses fear of letting others hold the baby, as she has similar images of dropping the baby during transfer to the other person. She reports no complication during pregnancy or delivery, but states she was very much more emotional this pregnancy, but it's unsure why. She reports she is breastfeeding and that this is the only piece of motherhood she feels she's coping with well. She cries more as she discusses missing her life before the third baby and how her other 2 children were such good babies. She says, "This one, she just never sleeps. I can't get any rest. I'm so tired." She struggles a great deal to transition to taking care of 3 children versus 2, and expresses she is a failure and things are never going to be normal again. She has decided not to return to her job as a financial advisor, and instead has decided to stay home full-time. Her husband does accompany her to the clinic, but she reported to the session alone, leaving him and the baby in the waiting room. Hi, how are you doing today?
Hi, I'm okay.
My name is Hanan. I'm going to be your therapist today. What's your name?
My name's Mindy.
Nice to meet you, Mindy. So what's bringing you in today?
Well, I saw my doctor and she wanted me to come in.
Okay, so why does she want you to come in?
She thinks that I'm having a hard time right now. I had a baby 5 months ago, and I'm just having a really hard time dealing with it.
Congratulations for the baby.
Thanks.
Yeah, but can you tell me more about what do you mean by hard time?
Yeah, I just feel like this baby is really hard. I have 2 other kids at home and they were really easy babies. And this one just cries a lot. And it's just, I seem to be like struggling to take care of her. I don't like want to get out of bed in the morning. Like I don't want to take a shower. I just want to sleep. And I keep having these thoughts that are kind of bothering me.
Okay, just reflecting back to what you're saying, you have 2 children, a little better than the new daughter now, and because she cries a lot more, right?
Yeah.
And that makes you tired and having and that makes you tired and having a lot of thoughts. Can you tell me about what thoughts you have?
Yeah, I keep having these thoughts where like I'm holding her and then I drop her. Like I'm becoming really scared that I'm going to drop her. And I know that like I'm not going to drop her, but I can't stop thinking, imagining dropping her. It's really weird.
Okay, so thank you for sharing and expressing your feeling. And I understand it's a lot you are going through right now. You mentioned that you have 3 children. Did you
Mhm.
experience the same feeling with the other two?
No, actually, I mean, it's hard when you have a baby. So I remember being really tired, but I don't remember feeling this overwhelmed.
Okay.
And it's
And
hard.
your
I just find it really hard taking care of three kids too. It was easier having two, and now three just seems really hard.
Yeah, that's understandable. But
Mhm.
yeah, I know it's very hard to take care of the three kids and the house, maybe also. And your other children, are they around or do they go to school?
One's in preschool and one goes to school. So I have some time just with the baby um, during the day. And I used to work, but now that we have three kids, I decided to stay home and be a mom. And before I had her, I kind of thought that like my family could come over and help. But now I'm so worried about everybody dropping her that I just get so upset thinking about it, and it makes me so upset and I start crying, and I can't have anyone else take care of her. But then I just feel so overwhelmed all the time. I just don't want to get out of bed.
Okay, so there are many issues that we discuss here. You say that you have being mother for the third time. It's kind of difficult for you. It's being like a burden of being mother, and also you are caretaker. And where is your husband in the picture here? Does he? What is the dynamic at home? Is he supportive? Does he help you?
He's supportive, but like also I think he saw me bounce back pretty fast for our other kids. And now we're 5 months already, and this is taking, he just kind of feels like it's taking me a long time and he wants things to go back to normal, and he doesn't understand like what the problem is. Like when I tell him that I'm so afraid of dropping the baby, he thinks it's crazy because I was such a good mom to our kids, but it's like a
Okay.
real fear in my head that I can't stop thinking about.
Okay, so when your husband goes to work and the kids go to school and you are by yourself with the baby, and when the baby starts crying and you're feeling those feelings, do you feel like you want to hurt the baby or yourself?
No, I don't. I feel like I could never hurt my baby, and I certainly don't want to hurt myself. And so I think that's why these thoughts are bothering me so much, because I would never hurt my baby. I just can't stop thinking about it.
Okay. And did you talk to your husband about your feeling and your concerns?
Yes, but I don't think he understands, and he just keeps trying to reassure me that I'm not going to hurt the baby and that everything's fine and that I'm a really good mom. But that doesn't, it's not making me feel better. Like it's not making the feelings go away.
Okay. So, what is like to be, you say you want to go back to normal. What is normal for you?
I guess normal would be, before I was working with the two kids, but I would work part-time. So some days I was working and some days I'd be home, but I was like the primary person at home. So I would keep our house clean while my husband was working full-time, and I would take care of the kids. I would make dinner for all of us.
And
And I think I used to be happy and smiling and laughing, and I'd get
Mhm.
up and take a shower and look nice. And all those things are like impossible now.
And can your husband help you? I know he's working full time, you said. Does he have like a day off, weekends or something?
He helps a lot on the weekends and then at night too, but I think he thought that he wouldn't have to help so much forever. And so now he's like a little confused about what's going on.
So when he helps, you mean he takes care of the kids and you have time for yourself?
Yes, or like he would take care of one and I would take care of one, or like the older one would go play with a friend and he would take care of one. So I do have, like, in the past I did have time to myself, but now with three and I'm breastfeeding, I really can't take any time away from the baby.
Okay. So is there anything we can do to help you go back to normal?
Um, I want to stop these thoughts
Okay.
because they don't seem rational to me, but it's really distressing.
Okay.
And I want to stop feeling so tired and crying all the time.
Okay. Um, so have you tried to do some journaling, like write down your feeling, your thoughts, your concern, and have
No,
them?
I haven't.
What do you like to do? Like, if you have time for yourself, what would be one thing that you like to do?
I like having coffee with my sister when we can. She's a really good friend and we can talk, and she has kids too. Um, and my husband and I used to go on date nights sometimes, and we'd get a babysitter or a family member to watch the kids so we could go out to dinner. So I like doing that too.
That's good. Have you tried any medication before?
No, you mean like for like a mental problem?
Yeah, antidepressant before?
Mm-mm,
No.
no.
Okay. We should work in like start working step by step. Maybe your husband, do you think will your husband or you will be open to we can try to have some couple of therapy?
I think he would be open to that. I mean, I think he'd be open to anything that would help.
That's great. That's
Mhm,
good. That's good support. So that will be good for you to express yourself in a controlled environment, and he
mhm,
can hear what you're feeling, what you're going through.
mhm,
So that will be a good start, and we can go by small steps. Like you can do like if you, we can talk about like plan scheduling thing. Like he can take care of the kids because I know he's working, but
mhm,
when he comes home, he wants to play with his kids too.
mhm,
So he can take maybe care of the kids, the three of them, and you can have time for yourself. You
mhm.
can do some reading. You can have coffee with your sister, as you mentioned. Does she live close by?
She's in the same neighborhood.
Okay. And you can do even some meditation, reading, or journaling, or even taking nice shower. That will be relaxing for you. Is that something
Worried.
you know? Yeah,
I'm
yeah.
just, I'm worried that my husband will drop the baby.
Okay. So we're gonna have to talk to. That's why it's good for him to be here, to be with
Mhm.
you on this on the therapy, so he can listen to your concern,
Okay.
and we take it step by step. That's all we can do. You can take the baby with you to you have coffee with your sister, for example,
Mhm. Okay.
at first. How the would you are you willing to work on that together?
Mhm. Yeah.
All right. And I just want to make sure that if you ever feel overwhelmed and you feel like you want to hurt yourself or some or your baby, please reach out to your husband, call your husband or suicidal crisis line. Just keep in mind that you are not there by yourself. That you have a good support.
Okay. Will you give me that number in case I need?
Yes, I
Okay.
will. Thank you.
Okay. We're at about 15 minutes. Here, hold on one second. I'm going to stop recording.